Thank you, everyone, for joining us. Today is September 25th. We are in the early days of fall. Thank you so much for joining us for tonight's family call. To those joining us live online tonight, as well as those of you who are watching the recording after the fact. My name is Rob Hatton. I'm the communications manager with Grey County, and I will be helping move things along and moderating the call tonight. Just before we do get into things, I just want to let everybody know that our call tonight is going to focus on Grey County's three long-term care homes as usual. That's Grey Gables, Lee Manor, and Rockwood Terrace. And if you do have any questions or concerns about your loved ones in those homes, please do contact the homes directly. And if you happen to be watching this and you have a loved one in another home that isn't operated by Grey County, please contact that home directly. Our format will be similar to previous calls if you've joined us before. So we're going to have a short update from Jennifer Cornell, our Director of Long-Term Care. Denna is going to follow that up with a little bit of an update. And then we do have a special guest joining us tonight, Jen McCharles from CareRx. So with that, Jen, I will pass it over to you for your update.
Great. Thanks, Rob. I'll just get my notes. So good evening, everyone. Thank you very much for joining us tonight. We last met virtually on June 26th, and we've committed to holding these calls 3 or 4 times a year. And as Rob said, here we are at the end of September already. Summer went by in a blink. For tonight's updates, just a couple of short updates, a little bit about the family information sessions that are coming up, a reminder about the resident and family experience surveys. I want to highlight just a little bit about a professional growth opportunity for our team members. Denna is going to give a clinical update on fall preparedness. And as Rob said, we have a special guest with us doing a presentation. So I'll get right to it. We have partnered with Bruce County Long-Term Care Department and the Grey Bruce Community Legal Clinic, to host family education sessions that will focus on power of attorney rights and responsibilities and long-term care homes rights and responsibilities. The guest speaker for these events is Angela Jensen. She's a staff lawyer with the Grey Bruce Legal Clinic. Sessions will be from 7 p.m. to 8:30 p.m. and they are coming up. So September 30th is at Sydenham campus in Owen Sound. October 2nd is at Gateway Haven in Wyerton. October 7th is at Rockwood Terrace in Durham, and October 9th is at Bruce Lee Haven in Walkerton. Pre-registration has closed, but if you're still interested in attending, you can contact Angela. I have a phone number here. What I'll do is I'll pop that information into the chat so that you can grab it. But I did see a couple of people have called in, so you might not have access to the chat. So you can either contact us, reply to the email that follows the meeting tomorrow, or contact Angela at 519-370-2200, extension 33. Earlier this month, we released the 2024 Resident and Family Experience Surveys. We do this in partnership with Align, so you may see the name Align linked with the surveys. The surveys were distributed either by email to the majority of individuals, and a handful received mailed hard copies. And we encourage you to complete them by October 9th. Your feedback is really, really important to us as it helps us enhance the care and services that we provide and helps us build our change management ideas and our quality ideas and strategies for the coming year. So please take a few minutes and complete that survey. A little bit about this professional growth opportunity. We're calling it the TRAIL program, and staff from all 3 of our homes will be participating in the Relational Approach Internal Lead, which stands for TRAIL program. The Relational Approach is a system created by Deborah Bakhti that empowers seniors care staff and families to build trust and respect as partners in care right from the beginning. It's about having a family relationship strategy. This is an intentional approach with how families are onboarded and supported in their new role as a residence family member in our community. The relational approach aims to transform this whole experience by fostering a culture where staff, families, and residents feel comfortable, valued, and appreciated. Our trail program is designed to train internal leads who will become relational approach influencers to confidently share the key learnings of the approach methodology. This includes insights from Deborah's 3 books, Take the Lead, material from the Recipe for Empathy, and her latest book, which we've been providing as people move in, called Now What? Navigating the long-term care journey. And information from these books and tools, along with her teaching, will support our staff members in being influencers, mentoring their peers and coworkers. Those sessions start at the end of October, and I look forward to giving you an update when the 6 sessions have completed and see what recommendations that group has for any policy changes and ideas to support families and residents as they move into our homes. And that is it for me. And so I'm going to hand it over to Dana to do the clinical update and to introduce our speaker.
Well, thanks, Jen, and hello, everyone. It certainly does feel like a fall day today. And as we approach the respiratory illness season, I wanted to share what our team has been getting into place to prepare as best we can. Homes are working on the annual immunization campaign for residents and team members. And our team attended the public health fall preparedness sessions that were held last week, where we learned that starting in early October, flu shots will be available for our residents and staff. So we're just in the process of ordering those and working with public health. We also have heard that Ontario expects to receive shipments of the updated COVID-19 vaccine from the federal government also in early October. And that will have a staggered rollout where our residents will be first on the list to have the opportunity to get that vaccine. And just as a reminder, it is safe to get the flu shot and the COVID vaccine at the same time. So I just want to assure families of that. We are also encouraging family members and visitors to stay up to date with their vaccines as well. And public health will be sharing information on how the general public can and when they get vaccines. So stay tuned for that. And along with the vaccinations, we're continuing to remind everyone, if you're not feeling well, stay home. And I think sometimes it's just a feeling of being a bit off. And then a day or two later, sure enough, you are not well. So stay tuned and take those early signs and symptoms. And school has started up again. And so if you're grandparents and you're hearing about kids in schools, you might be getting a call about that too. Kids needing to be off for the day. Hand washing is the first line of defense. And I know I've added a new hand sanitizer to my purse. So double check those expiry dates. And I've also added a new one to the vehicle today. So it's always good to have those on hand. So I encourage you to do that. And then also a reminder that we're mask friendly. So all of our Grey County homes have masks in the front lobby. And even if we don't have outbreak precautions in place, don't hesitate to put one on if you feel that. Our staff are doing the same, both when you're at the home or in the community. There's respiratory agents floating around, indeed. And we do know that infection control messaging has been shared a lot lately. You've heard us over and over again, particularly this time of year. But I wanted to share that the IPAC team will be trying to embrace fun in the messaging and learning. And so they're going to be setting up an escape room to celebrate Infection Control Week, October 14th to 18th, with the theme this year for Infection Control Week being Prevent with Intent. So I think there'll be really cool pictures coming out with that, so stay tuned. But the highlight of the night, I think, is that I get the privilege of introducing our guest speaker, Jen McCharles. Jen is a business development executive at CareRx, the pharmacy partner for all of our homes in Grey County. Jen is a registered pharmacy technician by background who's held many roles in the pharmacy sector, including a medication systems quality coordinator. She's been the manager of medication systems quality more broadly, and she's also been a director of pharmacy operations, which has led her to her current role. Recently, Jen had the opportunity to come and see our homes in person, where we asked if she would like to come and speak to us today and to provide an overview for families and friends about the role of pharmacy in long-term care. So without further ado, I'd like to turn it over to you, Jen, and you've got a few slides for us. And I think, have you got those to hit the share button? You're ready to go? Okay, so on to you, Jen.
Thank you, Dana, for that lovely introduction. Hello, everyone. It's a pleasure to be here tonight and do a little bit of a presentation for you, just to give you a little bit of a background of what we do as a pharmacy for long-term care homes. So what I'm going to do is I'm going to share my screen with you. I'm going to go through the slides. If you have any questions, just Rob have mentioned, if you guys could put it on the chat, and then I'll be more than happy to provide you feedback or response. And if I do not have the answer, I'll definitely give those, I will investigate it and then give the information to Dana to share with you. Can everybody let me know if you can see my screen?
It's just popped up here.
Oh, that's not the screen I want to share. It's the pharmacy screen. Can you see the pharmacy screen? Sorry, I'm not very familiar with Zoom.
Zoom's a little trickier there.
Yes, it's that. Oh, wait, there it is. There you go. Perfect. Now I can see. Okay.
And you're clicking in and out a bit, Jen. Is there a way to get closer to the microphone, perhaps?
Oh, sure. I have my headphones on. Is that better?
Yes, that's better. And now we see your slides too. Thanks, Jen.
Okay, perfect. Thank you for confirming that. So here's the agenda of my slide today. I want to give you a little bit of a story of how CareX came about, what our core services offering for all of our long-term care homes and retirement homes, as well as our independent homes. The thing of Long-Term Care Act. So this is the act that regulates long-term care facilities. Some information about the move-in process and ongoing, so that you are well aware of how we are well versed with the process and what we do for our homes. OTC, like the cost, the process, and the difference, and then billing.
Jen,
So CareX, yeah.
sorry to interrupt. I'm just wondering if
Yeah, of course.
there's a bit of a lag, I think, too, with your video. So I wonder if you try turning your video off while you go through your slides, if that might make the sound a little bit more clear.
That better?
Yeah, I think that's a little bit better. Awesome. Thanks.
Okay. Okay. Wonderful. Thank you for that. So, CareX, so we are one of the leading providers of services, and we provide services for residents in long-term care homes. So homes just like Grey County, retirement homes, group and independent homes. We have grown through acquisitions. So at the beginning in 1930s, we were known as Remedy Holdings Incorporation. And as you can see, throughout the years, we have acquired many, many different pharmacies across Ontario and Canada. Our most recent acquisition is the CareX Hogan Pharmacy, which is where I came from. So in Canada alone, we have 23 pharmacies that we have. London, Ottawa, Oakville, and Sudbury, they are the main ones that I kind of want to mention, just of proximity. And London is the pharmacy that services the Grey County homes. And this is a CareX model on how we provide support for our Gray County homes. So the leadership, service, quality assurance, it's a hexagon that we have here to kind of show the different types of services that we provide for all of our homes. So CareX role in LTC. So this is some of the roles that we have when providing services for long-term homes. Medication management. So what this means is that we ensure that medications being provided to the residents, if the dosings are correct, it's for proper administration, and we monitor the side effects for these medications. We make sure that it's appropriately prescribed, and any adjustments that are needed, our pharmacists will make those adjustments to ensure that these medications are appropriate for the resident and for the resident's treatment. We have a clinical consultant. She visits the home on a regular basis. I believe she's there once a month. And our clinical pharmacists, so they are expertise when it comes to drug interactions, contraindications, and any potential side effects of medications. So what they do is they work closely with the physician, the nurses, and other healthcare providers to make sure that the recommendations for medication adjustments or alternatives are provided to them. Patient safety. So this is one of the great things about having a pharmacy that's dedicated to the home. We ensure that we monitor any adverse drug reactions and ensure that the medications prescribed are safe and effective for any individual's conditions. So we also review lab results, diagnostic data to prevent any medication-related problems. Education and training. We provide education to the staff to ensure that the medications administered properly, stored properly, and any safe protocols related into ensuring that the medication is safe for use. Regulatory compliance. We help ensure that the facility adheres to provincial and federal regulations regarding any medication use, storage, and documentations. So this also includes managing any controlled medications and maintaining accurate records at the home. Medication reconciliation. I will talk a little bit more about this or more in depth in a later slide because this is one of our provision that we provide to the home. So the medications reconciliation, this is when we perform a medication history to ensure that the medications being provided to the residents during their transition of care, that there isn't any discrepancy. And so this medication reconciliation is usually done during admission or discharge of the resident. And family education. We also provide patient and family education about medication regimens, side effects, and importance of adherence to prescribed therapies. Usually, we send this out via newsletters, and this is provided every other month. Customized care plans. This is something that we work with the home as well to make sure that the medication plans that we have to the residents are specific to that resident to ensure that it applies to their health conditions. Quality improvement. We participate in any quality improvement initiatives to enhance medication processes, improve patient outcomes, and ensure the overall effectiveness of the medication management system at the home. So this is just an example of type of equipment that we use at the pharmacy. So this is what we call CAPvision. So this is how a medication is verified before they get dispensed to the residents. All the pouches are photographed, and we make sure that if there are any discrepancy, we do another check. Just because these robotics identify if there is a discrepancy with the medications that are being dispensed by our automated dispensing cabinets. So we, as a pharmacy, we have a commitment to ensure the quality of medications that are being provided to your family members are in greater accuracy. So what we do is, so our process at the pharmacy is that once we receive a medication from the home that is written by the physician, our pharmacist reviews those medication order first to check if there's any discrepancy or any interactions with the current medication list that we have on profile for your residents, for your family members. This is to ensure that if there's anything that needed to be done, that we can contact the doctor right away, so that we can send the medications at the home at a timely manner. We do go through an aid verification process. So in this aid verification process, we want to make sure, like I said, that the medication is correct and appropriate and safe for your family member. So currently, our accuracy rate is 99.99% when we have all of these checks and balance in place. So this is just some information as well regarding the support that we provide for all of our residents and staff members. So we have it separated, so the resident level support. So these are the consultant pharmacists who I mentioned earlier on come and visit, and these are some of the tasks that we have to do at the home level to ensure that your family members' medications are safe. Now I would like to talk about regulations and services that we provide. As you guys, or you may not be aware, that all long-term care homes in Ontario, they must adhere to the Fixing Up the Long-Term Care Act. So they do fall under Discoveries, which supports them, and also provide regulations and legislations for these homes to be open to the public. So Regulation 246, Section 128. So in here, it states that all long-term care homes must have a contracted pharmacy provider. So this means that any resident that's living in that nursing home, they have to have that contracted pharmacy to provide their medications. Unfortunately, the home cannot have multiple pharmacies providing these medications to the residents at the home level. So it has to be that specific pharmacy for them to provide the medications. And then also on Regulation 246, Section 129 to 149, this outlines the pharmacy provider's responsibility. And in that responsibility, that including medication supply, clinical support, and other pharmaceutical services. And these are in collaboration with the home. Pharmacy process. So I just want to talk a little bit about what a pharmacy process regarding when a resident is moving in. So pharmacy plays an integral part in the move-in process because during this time, we receive a list that has been provided to us by the home. So this could either come from the community or the hospital. And once we receive all of these information, what our pharmacy do is we do a very robust clinical reviews of all of these medications. What we do is we contact our community pharmacy to ensure that the list that has been provided to us is accurate. So, and sometimes when an individual is coming from a community pharmacy, there is always that possibility that they have had multiple pharmacies that have been supplying their medications. So what we would do is we would contact every single one of them to gather those lists to make sure that the medication reconciliation or history that we have is accurate. Once we have done or compiled our medication reconciliation, then our pharmacist will do a clinical review to ensure that the medication is appropriate for the residents. There might be some dosing discrepancy, the medication might not be appropriate, there might be some interactions. So those are the few things that we look at when we're doing our clinical reviews of all of those medications. And then once we have completed and we feel like the medication list that we have is the most accurate medication list just from acquiring all of those informations from other sources, then we will contact the physician to get their approval in regards to those medications. So we will have that conversation. We will inform the physician the changes or the discrepancies. And then once we have that completed, then those medications will be dispensed from our pharmacy and then provided to the residents at the home. As an ongoing service that we provide as well, to make sure that we have that medication management system in place. All medications prescribed by the physicians are clinically reviewed prior to dispensing. So from the initial time that your family joins the home and we have done our medication reconciliation, every single time we receive a new order or there's an order change, we will do a clinical review to ensure that the dose is properly prescribed and also to ensure that there's no interactions with any of the medications that your family member is currently on. Because there are times that your medications changes as well. And therefore, some people may react differently as they continue to have or to take their medication. So your dedicated consultant pharmacist who provides clinical support and initiatives to the staff, education provided to the home regarding medication, diseases, and regulations. So those are some of the ongoing services that we provide to the staff as in regards to the medications that are being provided or pharmaceutical needs that are needed at the home level. Over-the-counter products. So I just want to talk about over-the-counter products. So we do carry quite an abundance of over-the-counter products. Unfortunately, this must be provided by a contracted pharmacy as well as per the regulation for the act. Just to let you know, or maybe this is something that people are not aware of, is that even though these medications are over-the-counter medications and safe, they do sometimes interact with the medications that's being prescribed by the physician to your family members. So by having your pharmacy provider provide these medications, those medications will be going through a clinical verifications to ensure that they're suitable for your family member. So, and also that they work well because of the fact that, like I said, they may interact with the medications that your family member might be currently on, or there might be an adverse effect as well on your family members. So that's kind of reasoning why it's best for the pharmacy to provide this medication because of those clinical reviews that are being done in the background. Our cost is very similar to Shoppers Drug Mart. Unfortunately, we have heard in some of the feedback that we received from the family members that our prices are a little bit higher than Walmart and Costco. Unfortunately, because of the fact that they're a wholesaler, therefore they have a much higher buying power than us. And also another fact is that they buy a lot of the products in bulk. So therefore they get those products at a much lower cost than CareRx, just because we are not as large as Walmart or Costco. Billing. I just want to talk about our billing process. So for any medications that are prescribed by the physician, all those medications go through the government drug plan, which is the Ontario Drug Benefit. And if a family member or resident has a third-party drug plan, then after it's been processed to the Ontario Drug Benefit, it will then be processed to the third-party plan, and anything outstanding between those plans, that will go to the family or the resident, like the outstanding amount. Non-covered OTC medications, all those are provided at cost. We do not provide dispensing fee in regards to that. So however much the cost of the pill is, that's what we would charge the residents. Bright Squid, I want to talk about Bright Squid. So this is an electronic platform that we have implemented, and this is to be more environmentally friendly and security conscious. In addition to that, this allows for earlier delivery of statements and avoid any disruptions with Canada Post. So with Bright Squid, if you do decide to sign up for Bright Squid, you just let us know or you call our customer care. Our customer care will send you an email link to inform you that this is how you would sign up on Bright Squid, and it provides you a step-by-step process in regards to that. And that is the end of my presentation.
Thank you, Jen.
Does anybody have any?
Thank you, Jen. I think I don't see any questions in the chat, and I appreciate you persevering because we were able to hear it at the end. And I'm wondering too if when we share with the families, if we can take your slide deck, the actual slides, and maybe share those. But I really appreciate you sharing, and perhaps putting your camera back on now that you're not sharing the slides would be all right. But I really appreciate you sharing about the over-the-counter meds, which has been a question from our families. And so recognizing in that slide, as a pharmacy partner, that when you do purchase over-the-counter meds, there can be that cost discrepancy because of the buying power, but also the process that it goes where the pharmacist, and we're ensuring that the over-the-counter product aligns and doesn't contraindicate with any of the medication that the resident is on. And again, if there's questions or concerns, calling customer care, because the relationship with pharmacy is one that's directly with the family member. And I think that's really important to acknowledge. And our role, certainly, as you shared, is with the long-term care requires we do go with a pharmacy partner as that fixing long-term care, but the pharmacy relationship is with you, and we're trying to be supportive, and also those billing questions. So I don't see any in the chat, but I know that's one that has come forward. So thank you for that clarity. I look to Jen. Did you have any comments at this time?
I don't. I thank you for bringing your presentation and this information. It's really helpful, and I know people will be interested in seeing the slides. We send a follow-up email with the recording, and that's an opportunity for people who maybe are watching the video later. They can reply to that email with questions. So if there are any questions, we'll make sure we loop you in to be able to answer them. And I was thinking, Rob, as we were kind of waiting to see if there's any questions from people on the line, that with the follow-up email, we might include a question, a survey. I don't know the logistics on how to best do that, but asking if there are other topics that people would be interested in hearing about at the virtual family calls, and we can make those arrangements going forward as well.
Yeah, absolutely, Jen.
If any of
Sorry. Yeah, I was just going to add,
Sorry.
Jen, when we send the email out, we'll just have a simple one-question survey on there, and you'll just need to click the link to submit your ideas for topics.
Sounds great. And thank you too, Jen, for flagging about Bright Squid. I don't know how they name these billing, but if I got a Bright Squid in the name, as we're all trying to be really cautious of spam, and is this a legitimate email, not a legitimate email? But Bright Squid is unique. But the fact that it is a third party, we put it in our paperwork as well. If families have questions about Bright Squid, there are alternatives. So thanks again for flagging that. And again, just echoing Jen's comments, thank you so much for taking your time. I know in the evening, especially if you're in residential area, the Wi-Fi band is used up. It doesn't matter sometimes where you are. So thank you for doing that, and we'll get those slides set up. So that I really appreciate your time.
Thank you, everyone, for having me. And if there are any questions or any pharmacy topic related that you guys would like to be presented on Family Council, please let me know. and I'll be more than happy to support that.
Yeah, and sorry, I do see a question in the Q&A. Jen, before you go, could I contact CareRx representative directly after this call? And yeah, so we have that number. It's been in our newsletters. We can certainly add it. I don't have it on the tip of my tongue though. Do you happen to have the number that we call directly, that our families can call directly? Jen, was it on one of those slides?
No, I don't have it with me directly, but I can definitely provide that to you.
Absolutely. I know, as I said, we've got it in our newsletters, we've got it in our move-in packages, and we will make sure that you get that, Kathy. I just don't have it at my fingertips, but we'll get that, because our homes have customer care service. You can call, tell them who your person is, what home, and we can align, and then you can have that personal conversation. Hope that's helpful. We'll definitely get it to you.
We can include it in the follow-up email as well.
Perfect.
Yeah. All right.
Okay, I don't see any other questions in the Q&A, so we will just take it another moment here. If you have any questions related to Jen's presentation or any of the other update information, please do just put that in the Q&A or in the chat. Dana, I loved your update about the campaign that's going on and I think you have a really good slogan there that you said, and you didn't even realize it, and that's "Have sanitizer on hand." I think that's perfect.
I don't know. We'll have to maybe market that one somehow, some way, but have sanitizer on hand. I love it. Okay, we'll see.
I feel like we should market you, and there might be revenue generating. I don't know. You'll need to trademark that slogan or something.
There's an opportunity. That's one of the things. We'll make it work. But yeah, let's use it. So thank you, Rob.
I'm kind of interested to hear how the IPAC escape rooms will go. I think that sounds fun. I hope I'll maybe find out when they're set up, see if I can escape from infections. All of the fall is an escape room from infectious diseases, I think. Yeah. So, Rob, I think that we can wrap up the call. And again, thanks so much, Jen, for bringing the information and updates from CareRx. And thanks to everyone who's joined us. And I'll pass it back over to you, Rob.
Yeah, thank you everyone for joining us tonight, for taking time out of your evening, or if you're watching this later, out of the day. So we will, as usual, be sending up that follow-up email. If you have any questions that come to mind about what we talked about tonight or anything else, by all means, reply to that email and we will get back to you as soon as we can. As well, if you know anyone that you think would be interested in the topic of this call that you want to share the link to the recording with, we really do appreciate you passing that around as well. So I think if that wraps it up for tonight, I'll just wish everyone a nice evening, and we will see you at the next one. Have a good night.
Thank you.